Hi everyone, John from Lakelands and Miami Physiotherapy here. One of the most common injuries experienced is an ankle sprain injury. Usually, when the ankle is sprained, there is some form of ligamentous strain and may result in instability due to damage in the receptors within the ligaments. The goals for any acute ankle sprain is to manage the swelling, pain and initial inflammatory response while making sure not to be overly aggressive. Therefore, the first 4 to 5 days post-sprain, we focus on protecting the injured tissue with relative rest. Also, during the initial days, once some of the swelling has settled, it is very important to see a local skilled physiotherapist to assess the extent of ligamentous strain and to make an activity-specific rehab program. Optimal rehab will decrease time to reach baseline and has shown to reduce the recurrence of ankle sprain by approximately 50%. As I mentioned before, the injured tissue needs relative rest. The biggest problem with an ankle sprain is people tend to mobilise it for way too long. Instead, they need to be performing some ankle exercises to help initially with the swelling, but in the long term help with range of movement. These exercises are performed with putting no or little weight through the injured ankle. The first exercise that I'm going to show you is to maintain some ankle dorsiflexion. So what you'll be doing is placing your injured leg off the ground temporarily, putting it on a wedge or a towel, placing your weight through the heel and through your hands. I want you to bend forward, allowing the passive range of movement to occur. This will help with your range of movement as well as some of the swelling. Next is a seated exercise, using a TheraBand around the 2 feet. Heels on the floor, you place a band around the foot, and then you're going to be turning your feet outwards. What we don't like is coming from the hip, rather it has to come from the ankle muscles, like so. The last one I'll show you today is using a wobble board. You can use a ball or similar surface to perform this. Essentially what you want to put is something underneath that injured ankle to allow the freedom of movement in a controlled way. For instance, forwards and backwards, you can work on the control while getting the movement to keep that range of motion. You can go side to side. This will be a little bit sore, so it's not about flaring up the injury, it's about maintaining that range of movement in a controlled manner. If there is anything to take out of this video, it is to make sure you manage the initial reaction to an ankle sprain correctly. Some rest is necessary, but you do need a graduated movement and exercise program to get you back playing to the sport or hobbies you want to do. If you know anyone who could use some advice and treatment for their ankle sprains or their bad ankles, then come down to see one of us physios at Lakelands and Miami Physiotherapy.